Welcome back. Health Minister Zweli Mkhize says Gauteng, the Western Cape and Eastern Cape appear to have reached their COVID-19 peak and infections are now seemingly slowing. For more on the Minister's announcement then, I'm joined by Professor Shabir Madhi from Wits University. Prof, afternoon to you. Thank you so much for your time. So the operative word there in those utterances by the Minister this morning is may have reached their peak, these three provinces, but it's still too soon to say we are completely out of the woods, isn't it?
Well, it's too soon to say that we're out of the woods, but I think there have been some positive signals. As an example, in the Western Cape, they're actually starting to see a decrease in terms of the daily rate of hospitalization, which is a useful metric in terms of understanding exactly where we are with the outbreak. So the Western Cape seems to have peaked and they're on a downward trajectory. In Gauteng, over the past 2 weeks, there seems to be some stabilization in terms of the number of people that are being admitted on a day-to-day basis, which suggests that we're at the peak, but we'll probably continue at this high level perhaps for another 2 to 3 weeks before we start going downward. And then for the Eastern Cape, they probably still got another 1 to 2 weeks to go. Unfortunately, I don't have too much data from the Eastern Cape to make an informed opinion on that part of it. But at the same time, the reality is that in other provinces, including KwaZulu-Natal, the Free State, in Mpumalanga and Limpopo, they're still very much on the upward trajectory. So it's very provincial in terms of where they are with the outbreak currently.
The other issue, though, Prof, with this data and saying that the worst is over is that because of the demand in testing and this change in strategy, the only people who are being allowed essentially to test for COVID-19 are those who are showing the worst of the symptoms or those who are in need of very critical and urgent care. So how do we get an accurate enough picture of how we are doing when we're not testing as many people as possible?
Yeah, absolutely correct. And I think the challenge that we face right now is that when it comes to testing, in fact, there's a disproportionate amount of testing that's being done in the private sector. I think what the report I saw from the NICD today indicated that for the past week, as an example, almost 80% of testing that was done in the private sector. And obviously that means that we're significantly underestimating for the majority of the population. So the number of cases that are reported are not really a useful index in terms of where we are with the outbreak, because the testing rate over the past week again has declined compared to the week before. So I think what's a more useful metric in terms of how this epidemic is unfolding is sort of looking at the more standardized measure, which is hospitalization for COVID-19. And majority of people that are hospitalized would be investigated.
And the Minister also, in terms of just trying to get as accurate enough a reading of the COVID-19 picture in the country, was speaking about the issue of access deaths. People who die suddenly and those who pass at home will also now have a specimen taken from them to see what exactly had gone on as far as COVID-19. But one could argue that this should have happened as early as March when the outbreak hit South Africa. Would you agree with that?
Sure. I think we should have had a much lower threshold to investigate people that were hospitalized as well as people that die. And it's great that that's going to be done now, but unfortunately it's not going to redress what has happened in the more sort of larger provinces, Gauteng and the Western Cape, where they've already peaked. So a substantial number of cases that have died where COVID wasn't investigated for might well have died of COVID, but others might have died of other conditions, which resulted because of them not being able to access healthcare facilities for one reason or another.
Are we headed in the same direction, Professor Madhi, as the United Kingdom, where at the peak, for example, they had not been counting in their tally the number of people who died of COVID-19 in care homes? Once those figures were in, there was a dramatic jump in those official figures by government. Is that where we're going?
Well, I think that's an unfortunate reality, and it's not just the United Kingdom or South Africa, even in the United States and in many other countries, especially where they've had large number of individuals that have died. There is going to be a significant underestimate if you just base your diagnosis on people that are investigated for COVID-19. And it wouldn't be unique for COVID-19. This is something that we see year on year as an example for influenza, where we don't investigate, so you really don't know whether people have died. But using the type of modeling which the Medical Research Council has been using allows us to get some sort of a guesstimate as to what the true numbers. And right now, those numbers indicate that the true number of people that have died of COVID-19 in South Africa is at least 2 to 3 times higher than the number that have been diagnosed.
Dexamethasone again getting praise at this briefing by the Minister. It's managed to improve our ICU survival rate currently from July to where we are now. I think those were the dates. You are involved in a trial linked to trying to find a vaccine for COVID-19. I'm thinking of comments by the head of the WHO earlier this week where he was saying, cautioning in fact, against pinning our hopes on a single vaccine that will get rid of COVID-19. I'm just keen to get your thoughts on both strands.
Yeah, so I think this whole issue about case fatality rate is really an unfortunate analysis that is being done and propagated. It tells you very little in terms of how one country is comparing to another. The more important measure is the number of COVID deaths that are occurring per million or per thousand of the population, as an example. And when you then start adjusting for a possible underdiagnosis or underreporting of COVID deaths, you find that South Africa is not very unique at all. In fact, we report about 150 per million of the population of confirmed COVID deaths, and if you multiply that by 3, that goes to 450, which is sort of in the ballpark of what exists elsewhere. So when talking about case fatality rate, and we probably don't have the time to go into that detail, it's subject to a number of issues, which makes it impossible to compare between countries or even between provinces. So I wouldn't put too much emphasis on case fatality rate at all. It's the number that have died per thousand of the population or per million of the population, adjusted for the underreporting. In terms of the vaccine, I think the WHO is completely correct. It's unlikely that we're going to be able to, and it's not about having a single vaccine. For vaccines to be an effective strategy, we're going to need to have at least a handful of vaccines that are effective so that there can be adequate supply of those vaccines. And it is unlikely that a country such as South Africa, despite us being involved in those clinical trials, would be able to gain access to vaccines earlier than the third quarter of next year, by which time we're very likely to be experiencing another outbreak of COVID-19. So I don't think the immediate solution is a vaccine. That is sort of the medium to long-term solution. The only thing that's within our grasp at the moment is to try to control the rate of transmission of the virus, and that is basically adhering to the physical distancing, avoiding overcrowding, wearing a face mask.
Professor Shabir Madhi with Wits University, thank you so much for speaking to us, as always.